I'm Carrie Grins from the WHYY Health and Science Desk. On First Person this week, we're going to take a break from election coverage for a moment to deal with another event this fall season, the flu. Here to discuss that is Dr. Carol Rattay. She's the director of the Division of Public Health in Delaware. Thank you very much for joining us.
Thank you.
First of all, give us an update. Have we seen flu yet in Delaware this season?
We really haven't seen much. We've seen one case to date, and so really it's pretty quiet at this point, which makes it a really good time for people to get their influenza shot.
Well, let's talk about the vaccine, because last year we were dealing with a pandemic and trying to get a new vaccine available to people. What is available this year?
Well, this year, as in every year, there's your flu vaccine is going to have, it's going to cover 3 strains typically of influenza, 2 of A and 1 of B. This year it does include the H1N1 strain, so last year it had to be a separate shot just because of the timing of things. This year it's combined. It'll come in 2 forms. So there's a form that you can, for people who are ages 2 to 49, healthy people can get it up their nose, the intranasal, and then otherwise anybody 6 months and up can get the regular influenza shot in the arm.
And it's widely available now?
It's widely available now.
So this is a combo shot and includes, like you said, the H1N1, which we were calling the swine flu for a while,
right,
and the seasonal flu. But we're not in a pandemic anymore. So can you explain for me what that means, if that we're still concerned about H1N1 circulating, yet we're not in a pandemic? What does that mean?
Well, we're not seeing a lot of people infected with it anymore. And what happened really is that as it circulated last year, a lot of people became sick from it, and so their immune system now protects them against it. Additionally, many people got the vaccine, so they're protected against it. And so even though it's one of the strains that we saw in the Southern Hemisphere this summer, and that means we'll expect to see it here this winter, there's not a whole lot of it. There wasn't a whole lot of it in the Southern Hemisphere, and we don't know, but we don't think we're going to see a whole lot of it here, but it is probably going to be one of the strains that we do see.
Last year there were priority groups for the vaccines. Do we have that again this year, where certain people are prioritized to get it first?
Well, one of the things that is new this year is the vaccine is now recommended for everybody ages 6 months and older. However, there's always going to be people who are at higher risk of complications. That would be individuals who are really over age 50, young children, and those with chronic underlying conditions. And so for those individuals, or individuals who are around people at higher risk, there's a special emphasis for those individuals to get the flu vaccine.
What did you learn from going through a pandemic last year as the head of our public health division?
Well, it was a good learning experience for us. One of the great things is it wasn't that serious, so we didn't have a lot of people in the hospital or a lot of deaths. But some of the things we learned is we got to put our preparedness plans in place. So we got to dust off some plans that had been on the shelf for a while and try them out. So for example, in an emergency, how do we communicate with individuals? How can we vaccinate a lot of people in a short amount of time? Things like that. So we did get to do a number of exercises, which was helpful. It also, I think, really created some very strong partnerships with us, for us with others, such as with the hospitals and with healthcare providers. One other thing that we did learn is how important it is to communicate to all different groups and to try to tailor the communication message differently based on different ages, different racial and ethnic groups.
Very good. Well, I hope this season is a calmer one.
Thank you.
Thank you, Dr. Carol Rattay. We appreciate the update. Dr. Rattay is Director of the Division of Public Health, and she's our first person this week.